If you think medical mandates are okay, in this talk, I'm going to very specifically explain how you are wrong. And that's not my opinion, that's just an objective fact, an objective moral fact. I'm going to explain exactly why anyone who thinks medical mandates are a good idea, I'm going to pinpoint the exact flaws in that position. If you think, for example, that it's legitimate for someone to lose their job, their means of livelihood, their means of paying for basic expenses, because they refuse to give over their bodily autonomy to the state. If you think that person is in the wrong for not just complying, I'm going to explain to you exactly why you're wrong. If you think all of the people that have had adverse reactions to the medical devices, for example, masks and medications that are being pushed by governments, if you think all of those adverse reactions are irrelevant or somehow even non-existent, I'm going to also offer you some reasoning here to hopefully snap you out of your delusion, which is so deep that you would not even accept seeing a cause and effect relationship happening before your eyes, wherein someone is in good health and then takes some experimental medication or starts using some medical device and soon thereafter suffers negative consequences. But your delusion in the form of idol worship is so strong that you just refuse to accept the possibility a mandate delivered by, apparently in your mind, perfect overlords that should be obeyed without question. So please listen further so that you can hopefully have an aha moment and recognize exactly how your thinking and your morality is flawed. The number one problem is people abandoning the non-aggression principle because of their idol worship. In the context of medical tyranny, you can pinpoint when this abandonment of that principle occurs, when the idol worship kicks in through a particular critical thinking exercise. Imagine you're living in a neighborhood and your next door neighbor comes to your house one day and says, I have this new wonder drug that I think is going to prevent you from getting the flu. And because that would be better for society if no one got the flu, I want you to take this wonder drug. Now, what would be the common response by most people? It's fair to say that most people might say something like, well, thank you for the recommendation on this medicine, but I'll need to do my own research. I'll need to look into it myself. It's not your place to push drugs on me, right? And that would be the correct response. Now, why exactly? Ask yourself, why is that the correct response? Why declining your neighbor's insistence on you taking whatever drug they think is best, why is that morally correct? It's morally correct because your neighbor does not own your body. Your neighbor is not your master, right? If you own your own body, then you get to control your own body. And moreover, why would it be correct to assume that your neighbor can make a better medical decision than you can? Just because your neighbor thinks he has the best medicine in the world, why should that assertion be taken as fact? That would be irrational. Why is it impossible that you actually have a better medicine yourself? Or why is it not possible that you have some other means of staying healthy that's superior to whatever medication your neighbor believes in and wants you to take, right? So, number one, your neighbor is not your master. You're not the slave of your neighbor. And number two, your neighbor could be mistaken concerning what's actually the best medicine. And additionally, it's even possible that your neighbor could be holding an ill intent, meaning they actually know the medicine isn't effective, but they want to harm you for whatever reason. You could say that's unlikely, but still a possibility, right? So, for all of these reasons, the morally correct, the logically correct, and factually correct stance or position is to say to that neighbor, you do not have the right to coerce me to take whatever drug or use whatever medical device you think is best, right? So I think most people would agree with that reasoning, would agree with that logic, would agree with that morality, would agree with those facts stated. So here is where the departure from truth, logic, and morality occurs, wherein if you simply change the scenario slightly so that it's not your neighbor trying to coerce you to take a certain drug or use a certain medical device, and it's a so-called authority, like, say, a politician, this is where the idol worship and the delusion kicks in. This is where the statism kicks in. This is where the Stockholm syndrome kicks in. And it's completely irrational. It makes zero sense. Why would you think that it suddenly becomes okay just because instead of it being your neighbor, it's now a politician? How does it become morally sound and rational and based on truth just by changing the neighbor to a politician? Not only does it not change on a fundamental level, it's actually more irrational to assume that a person in this position of power would somehow be more trustworthy, and how it would somehow be better to give them a free pass to be abusive. It makes less sense than letting your neighbor do that. So this just shows like the complete moral retardation of mainstream society. In a scenario where it's you and your neighbor, you're able to comprehend that it's wrong. But in a scenario where it's dealing with institutions of power, people in institutions of power that are historically abusive and deceptive, you somehow think it's a better situation. It's an exception. In other words, the scenario wherein it makes less sense to comply, most people think it actually makes more sense. They think it makes more sense to trust in these authorities to do things that are clearly unethical, when in fact it makes even less sense. It makes no sense to allow anyone to do this. It makes no sense to accept abuse from anyone, but to accept abuse from people that are currently and historically known to be abusive and are practicing abuse on a daily basis, for example, via extortion, otherwise known as taxation, that makes even less sense. So people are clinging to a morality that makes no sense whatsoever and is actually exceedingly irrational. And yet they think it's somehow more rational than a scenario wherein you're dealing with a neighbor. And the only reason why someone would go off on this irrational, delusional tangent is if they somehow look at the so-called authority as some kind of divinity that just needs to be worshipped without question, right? The morality changes to simply whatever authority says to do, I should do, because doing what authority says is good, right? So it's this like meta narrative. It's an overarching morality that's false, that cancels the basic fundamental ethics that comes into operation when you're just dealing with so-called ordinary people. The new morality, or, the delusional morality that takes over is doing whatever authorities say equals the moral good. And that's simply known as an appeal to authority. It's just a logical fallacy that assuming that whatever a so-called authority says is good and true and logical is good, true, and logical. It's just an assumption. It's not sound reasoning. It's not rational at all. And people follow this false morality because they've been indoctrinated to accept it, to believe it. But it's, like I said, actually fair to call it moral retardation because it's not only irrational, it's exceedingly irrational. It makes no sense whatsoever. It's baseless in any kind of intelligent way of, perspective. There's nothing solid there. It's just an assumption, and it's an assumption that is exceedingly bizarre, because why you would assume that the people that are consistently and historically abusive would somehow be more trustworthy and would somehow be worthy of a right to be abusive. It's just craziness. And because of this acceptance of this false morality, society has gotten progressively worse, where it's become more of a police state, more of a farm for humans, where your bodily autonomy is compromised on a regular basis, wherein you have to take certain medications or wear certain medical devices just to do normal activities, like go for a checkup at the doctor, go, you know, travel, go to a sporting event, or, go into certain buildings. The idea that this is actually a good idea and that this is acceptable and it's for the greater good is just false in every conceivable way. I don't know how else to communicate this. If you can't recognize that giving over your bodily autonomy to the state is a bad idea, you're deep into delusion, namely idol worship of so-called authority, and you're condoning and supporting totalitarianism, medical tyranny, and a much shittier world for ourselves and future generations. It's that simple. I'm sure some people, though, would immediately respond, it's not that simple because there's a pandemic and we need to do something. And you're just so freedom loving that you just don't even care about people. If you have thoughts along those lines, you're again not using critical thinking. You're assuming, first of all, that just because you don't necessarily understand what I'm communicating, that I'm wrong. And you're also assuming, again, that whatever is being mandated is the best treatment. And you're also not recognizing that you're giving over bodily autonomy to the state, which is not a safe thing to do for ourselves or for future generations. You've actually decreased the safety and well-being of society by accepting that premise, right? They set the new precedent that the government can make medical decisions for a population, and you accepted that premise based on foolishness, based on moronic morality, based on idol worship. You're not actually helping society by saying whatever the government says to do concerning health, that's going to make the world a better place, right? It's not denying the existence of illness. It's denying the moral superiority and the right to abuse of governments. Can you follow that? I'll repeat that. If someone is against medical mandates, they are not denying the existence of an illness. I mean, I shouldn't even have to say that, but again, the retardation is comprehensive. It's beyond just of an ethical nature. People go off on these red herrings, or I should say, straw man arguments where they say, oh, you're denying the existence of illness, or oh, you just don't care about anybody. A medical mandate is not legitimate because it's unethical, because it's abusive. Abuse is not a good solution to any problem, whether it's medical, economic, or otherwise. That's the simple truth. So again, it is that simple. I hope this makes sense to you. Thank you for listening.